Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Carlos in here with us this morning. Is it morning or afternoon? I don't even know.
It's still morning.
Still morning? Okay. So Carlos comes in here today seeking some relief for pain that he has had since 1983. I just went over his MRI and also his radiology report, and his MRI does show that he has 3 moderate to severe size herniated and extruded lumbar disc at L3, L4, and L5. That's 3 levels. The 3rd lumbar, 4th lumbar, and 5th lumbar. Now he's also though got a lot of compensatory spasm and tightness in his lower thoracic spine. So this is his very first visit here to Advanced Chiropractic Relief. He found us watching our YouTube videos looking for some relief. Does that make you a crack addict, huh? Okay, so let's have you close your eyes again now, and I'm going to have you flex your head forward and backwards for me, Carlos. I mean that in a good way, cavitation addict. We redefined the word crack addict. Yep, see his head's forward and over to the right. His pelvis has shifted left of center, which is putting more weight bearing down on this right side. And you have more of the leg pain and numbness on that right side than you do the left, right?
Yes.
So the very first adjustment I'm going to do on Carlos today is not the biophysics adjustment, but I actually am going to bring him over here and do this Gonstead knee chest adjustment on his lower thoracics first. Watch that cord.
Yes, sir.
And if I can get the paper separated from that. My man.
Just use 2.
Huh?
Just use the 2.
Yeah. Okay. Go ahead and put your face up in there, knees right down there. And your chest will be on that. And then you can just rest your arms all the way down to the bottom there. Now I want you to let your spine kind of just sink with gravity. Just let gravity kind of sink down in there. So you can see that he's got quite a kyphosis and he's got muscle spasm right here in this lower thoracic spine. So I'm contacting the spinous process at T12L1 and doing a really deep P to A move in there. Okay, let's come over here on this table now. And we're going to have you land your tummy here, face down. Now his right leg was a ½ inch shorter when I checked it a while ago. It's even now just after doing that. Does that feel any easier than the first time?
Yes.
Okay, so I'm going to get started adjusting his SI joints. That's the right one first, then the left one. And then the sacrum, straight superior to inferior and posterior to anterior on the z-axis. Superior to inferior on the y-axis. And now I'm on L5 and I'm going to drive that straight P to A. There we go. Okay, keep breathing for me, Carlos. There you go. That's it. Okay. You're going to feel your head popping up a little bit on this next one. There we go. Good. Okay, let's turn you on your back now. Now, Carlos has had an epidural steroid injection for this already. Excuse me 1 second. Okay. Just hand sanitizer on before I go touching your face. You know what? While I'm letting this dry, I'm going to pull your leg first. There you go. Now you should have felt that from your knee all the way up to your lower back, Carlos.
Yes.
Same thing here. Let me have this leg go limp. There you go. Good job. Okay, now slide back up that way a little bit. Good. slide down about a half an inch and put both arms straight out to the sides. Now I always check with a patient that has severe extruded herniated disc in the lower lumbar spine or mid lumbar spine down. If they've ever had bladder or bowel dysfunction, which means you lose control of your bladder or bowels, that's a really important neurological finding. Let's sit you up, face that way. Yep, sideways always. Okay. And can indicate cauda equina syndrome and a severe neurological compromise, which if you have the loss of bladder bowel function, you need to have a surgery within 24 hours. You'd be wearing a colostomy bag or a catheter the rest of your life. So we talked about that with Carlos already. Always make sure to advise my patients of that, because they could be out playing in the park and all of a sudden lose control of their bladder or bowels. And knowing what you know now, you would get to the hospital, right?
Yes.
So let's come over here and lay on your back. But watching our videos, I know that Carlos instinctively knew this is what he needed. Is that right?
Yes.
Okay.
I'm a little scared of this one here.
Yeah, most everyone is. First time. So this is his very first time doing this.
There we go.
So just kind of breathe shallow through your nose, let your legs bend and relax naturally. This is how you should start sleeping, with your legs elevated like this,
Okay.
parallel with the floor, like this. Does that feel more relaxed down in your low back?
Yes.
Okay, so just keep your teeth together. Breathe through your nose. Move your right big ear. There you go. Now you should have felt that go all the way down.
Yes.
Did you?
Yes, it did.
Now, see, we checked these reflexes before in the neurological exam, and they were good, and they're still good. And I don't check those because I think I'm going to paralyze him. I just check them to see if they even improved. Perfect. That's it. Crack Eight's going to love you too. So, kind of get up sideways and push yourself up with your left arm. Yep, just like that. Stand right here in front of the mirror for me again. Already feels a little better, doesn't it?
That feels a lot better, yes.
Yeah. Let's have you flex your head forward and backwards for me. And then back to neutral. See, you're standing up straighter already. And you got more equal spacing here now. Just pull this, your homework. Pull these up and back. I'm going to bring that head straight back and then look at the wall behind you. Full extension. Extension is your new best friend, and flexion is your enemy with herniated disc. Extension is good, flexion is bad. Okay, relax. Now, when you flex your head forward and backwards again, tell me if this feels any smoother to you this time
Yes.
than the previous two times. Good deal. So, this being your very first time of having your manual spinal decompression ring dinger adjustment, how would you describe your first experience here at Advanced Chiropractic Relief?
Excellent. Different. Something different.
Now, you've been to other doctors with this, and they've examined you and
Yes.
done MRIs and injected you and even tried to adjust you.
Yeah.
How has this compared with that treatment?
I just feel a lot better.
You feel better now?
A whole lot better, yes.
Yeah, good. You still having leg pain?
No.
That's the one
For some
adjustment.
reason I don't.
Yeah, well, that's because we took the pressure off the disc.
That's, yeah.
Because when I do the manual spinal decompression, I create a negative vacuum within the disc space. It sucks the nucleus back inside the disc, which takes that pressure off the nerve, which takes away the leg pain and the numbness and tingling sensations. So, if you're suffering from herniated disc, Lord help you, don't go as long as Carlos did without getting an examination and treatment for your lumbar spine And we always love helping people with herniated disc and radiculopathies here at Advanced Chiropractic Relief. So just email us at advancedhoustonchiropractor.com and fill out a new patient request form, and Renee will get back to you with an appointment time. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.
See y'all soon.
That's it.